Okay, hi, hello, how are you?
Good.
I'm Katie and I'm going to be your nurse practitioner student for today. Can you tell me your name and your date of birth?
Hello, February 16th, 1993.
Okay, great. I'm going to be doing your head to toe assessment for you today. Okay, do you have any issues today?
No.
Okay, no problem. So I'm going to be starting by, I'm going to be inspecting your skin. Patient's skin is symmetrical throughout, even throughout. Her skin color is appropriate for her ethnicity. No swelling noted, no mass, no lesions, no rashes. Okay, I'm going to be palpating. Her skin is warm to touch. Do you have any tenderness when I palpate?
No.
No tenderness when I palpate. Okay, so now what I'm going to be doing is, oh sorry, her skin turgor is resilient. Okay, so I'm going to be inspecting her skull. Her skull is normocephalic. Do you have any tenderness when I palpate? No tenderness. Her hair is evenly distributed. Her scalp is clean. No signs of scaling noted. No signs of alopecia. Her hair is evenly distributed to her eyelashes and also her eyebrows. Okay, I'm going to be palpating your temporal artery. Pulsation is 2+. Do you have any tenderness when I palpate?
No.
Okay, so now I'm going to be assessing your cranial nerve number 7, which is your facial nerve. I'm going to ask that you smile for me. Okay, puff your cheek. Frown. Alright, so this indicates that cranial nerve number 7 is intact. And now I'm going to be assessing your eyes, okay? I'm going to be using this chart to do your visual acuity. You're going to cover one eye for me. Do you use any corrective lens?
Yeah, contacts.
You have it in?
Yeah.
Okay, great. So you're going to read the bottom line for me, starting from the left.
LTFPH.
Okay, you're going to do the opposite side.
HPFTL.
Okay, now you're going to do both eyes.
LTFPH.
Okay, can you just do it again for me?
LTFPH.
Okay, great. So this indicates that patient's visual acuity test is was done and her vision is 20/20 bilaterally. This also checks for cranial nerve number 2, which is our optic nerve. Okay. So now I'm going to be assessing her eyes. So I'm assessing your eyes for symmetry. Your eyes are symmetrical. Your iris are brown and they're well defined. No signs of crusting, no lesions, no drainage noted, no signs of redness, no edema. Hair to her eyebrows and eyelashes are evenly distributed. I'm going to be touching your face, okay? Alright, so I'm going to ask that you look up. Great. Look down. Okay, so conjunctiva is pink and moist. Sclera is white. No signs of jaundice noted. Her pupils are round and they're approximately 3 millimeters. Medial and lateral canthus appears to be intact. No discharge, no drainage, no crusting noted. Lacrimal system appears to be intact as well. No signs of corneal opacity. Okay, so now what I'm going to do is I'm going to be assessing your eyes with my lights. I'm going to check for pupillary response. Okay. All right. Okay, so pupils reacted to light, and when light was shined directly into the eye, and I'm going to be assessing for consensual light reflex. So I'm going to be shining the light and checking for a reflex in the opposite eye. Alright, so her opposite eyes, her pupils constricted when light was shone into the opposite eye. This shows that she has reaction to consensual light. Her pupil size is at 2 millimeters and they're equally round bilaterally. Okay, so now what I'm going to ask you to do is I'm going to ask you to look over here at the wall and then you're going to look at my near object. Okay, so all the way to the wall and then at my near object. Great. So patient's eyes dilated when looking at the far object and constricted when she looked at the near object. So the next thing I'm going to ask for you to do, as I move my pen towards you, you just focus on the tip of my pen, okay? Alright, great. So this shows that patient has convergence symmetrical, and so she has accommodation and convergence were both done, and those are symmetrical. Yeah. Next thing I'm going to ask you to do is to cover one eye for me, please. you're gonna tell me when you see my fingers, okay? I'm going to be coming from different angles. So you let me know when you see my fingers.
Now.
Okay?
Now.
Okay.
Now. Now.
Okay, cover the other eye. Tell me again.
Now. 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 Now.
All right, thank you. So this shows that patients was able to see my fingers when they were coming closer to her, which shows that her visual fields are intact. Okay. Now, next thing I'm going to ask that you do is that you follow my pen with your eyes. I'm going to go in the H motion. Okay. Okay. Alright, great. And there was no signs of nystagmus noted. So patient had extraocular eye movement test was also done. No signs of nystagmus, as I said before. And this indicates that her cranial nerve 3, 4, and 6, they are intact. Cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens. Okay. So now what I'm going to ask you to do is I'm going to flip my light off. And in this test, I'm going to be assessing for her red light reflex. I'm going to check her retina. Okay. I'm going to be using my left eye to look in her right eye. Okay, red light reflex noted. Wow. Okay, other side. Okay, great. So, checking for the vessels. Okay, all right. So there was no edema that was noted. No edema noted. Red light reflex was seen. Cup-to-disc ratio 0.3. No vessels were noted around the macula. No opacity noted in either eyes. No edema. Her retina appears to be orange. So now we're going to be inspecting your nose. Okay, so we're inspecting the nose for symmetry. Her nose is symmetrical. No drainage noted. No air of crusted noted around the nostrils either. I'm going to ask that you occlude one nostril for me. Breathing it out. The other side. Okay, great. So that means that her nostrils, they are patent. We're going to be assessing cranial nerve number 1. So now we're testing for your sense of smell. I'm going to ask that you close your eyes for me, please. You occlude one nostril, and you're going to let me know what is it that you're smelling.
Coffee.
Okay, great. Occlude the other nostril. What are you smelling?
Perfume.
Okay, great. So this says that her sense of smell is intact bilaterally, and her olfactory nerve, which is the sense of smell, cranial nerve number 1, is intact. So now I'm going to be palpating your nose, and you let me know if you have any tenderness.
No.
Okay, great. No tenderness. I'm going to palpate in the maxillary sinus.
No.
Okay, the frontal sinus. Any tenderness?
No.
No tenderness. I'm going to be using my light. Shine a light just to look in, okay? Okay. Alright, very good. So no septal deviation noted, no polyps, no mass. Her mucosa was pink and moist. Patient did not have any discomfort on examination. No discharge noted. Now I'm going to be inspecting your mouth, okay? So her lips, they are symmetrical. No crusting noted. Her lips are pink and moist. I'm going to be using my tongue depressor, and I'm going to be checking for your buccal mucosa. Okay, so let me grab my light again. Alright, so open for me. Say ah.
Ah.
Alright. Good. So so her uvula is midline, her tonsils are 2 plus, no white patches noted, mucous membrane is pink and moist, hard and soft palate pink, no signs of exudate noted, no redness, no bleeding to the gums noted. Can you lift your tongue up? Good. No exudate, no dental caries, signs of halitosis. So now I'm going to be checking for the cranial nerve. Excuse me. I'm going to be checking for your cranial nerve number 9 and 10, which is the glossopharyngeal, and also for your vagus. Sorry. Check for the gag reflex. So I'm going to put this to the back of the tongue. Okay, great. So gag reflex is intact. Sorry, gag reflex is intact. I'm going to ask that you stick your tongue out for me, please, and you move from side to side. All right, great. So this indicates that cranial gag reflex is intact. Cranial nerve number 9 and 10, which is the glossopharyngeal and her vagus, they are also intact. Now we're going to be assessing for cranial nerve number 12, which is the hypoglossal. I'm going to ask that you repeat these 3 things for me. Light, might, dynamite.
Light, might, dynamite.
Okay, great. Patient was able to repeat those 3 words that was asked by her, which show that her cranial nerve number 12 is intact. So now what I'm going to ask you to do is occlude one ear, and I'm going to be checking the vestibular ocular, which is cranial nerve number 8, and this is going to be the hearing test. Okay, tell me what you hear. 1, 2, 3.
1, 2, 3.
Okay, occlude the other side. Tell me what you hear. ABC.
ABC.
Okay, so patient was able to hear what was when I whispered 1, 2, 3 ABC. They show that her hearing is in her cranial nerve number 8 is intact, and her gross hearing is also intact bilaterally. Okay, so now I'm gonna ask you I'm gonna be checking your conduction test, so sensory conductive test. Okay, so I'm gonna be doing the Weber's test and the Ryan's test. Okay, you let me know if you feel the vibration unilateral or bilateral.
Both sides.
Okay, great. So patient said that she has said her sensory hearing is intact, and now I'm going to be putting the vibration on your mastoid process. You let me know when it stops, and then to the ear, you let me know when it stops.
Stop.
Okay.
Stop.
Okay, and then do the other side.
Stop. Stop.
Okay, great. And this indicates that ear conduction is greater than bone conduction. So now I'm going to be assessing your ear. So we'll start by assessing your auricles. They are symmetrical, no swelling noted, no signs of redness, no lesions, no masses noted. Do you have any tenderness when I palpate? No tenderness. I'm going to be palpating the mastoid process. Do you have any pain when I palpate? I'm going to palpate in the tragus. Do you have any tenderness when I palpate there? So no tenderness when I palpate. So now I'm going to be looking into the ear. Okay, so let me pull in the auricle up and back. Alright, so suramen is 10% in the left ear, tympanic membrane is visualized and it is pearly gray, cone of light to the left ear is at 7 o'clock. We're going to go to the other side. Auricle up and back. Okay, suramen is 10% to the right ear. Tympanic membrane is visualized and it's pearly gray. Pars and Mars flacida present and intact, and cone of light is at 7. No edema, no swelling, no redness was noted. Okay, no scarring noted in bilateral ears. Okay, so now I'm going to be assessing your neck. Okay, so there is no mass noted to the neck, no swelling, is in proper alignment. I'm going to be using the one finger test to check for a tracheal deviation. Okay, so no tracheal deviation noted. Do you have any tenderness when I palpate? No tenderness when I palpate. No pulsation noted to the neck, and it is symmetrical. So now I'm going to be palpating your lymph nodes, okay? So pre-auricular, post-auricular, occipital, tonsillar, submental, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Do you have any tenderness when I palpate?
No.
Okay, so no tenderness was felt when I palpated her lymph node. Her trachea is in line, no deviation noted. Now I'm going to be assessing her thyroid. What I'm going to ask for you to do is to swallow for me. Okay, so thyroid appears to be midline, no deviation, no nodule felt. Do you have any tenderness? No tenderness, and both nodes appears to be equal in size. Okay, so now I'm going to ask you to turn. Okay, so now I'm going to be assessing the posterior chest. So no rashes noted, no lesions, no area of redness, no swelling, no mass noted. Do you have any pain when I palpate? No pain when I palpate. Appears to be symmetrical. So I'm going to ask that you say 99 for me.
99, 99, 99, 99.
Okay, great. So tactile fermentous felt when patient repeated 99. I'm going to be percussing. Okay, so resonance heard on percussion. Now I'm going to be auscultating every time when you no, first I'm going to be checking for diaphragmatic excursion, okay? Can you take a deep breath and hold? Okay, release and hold. Okay, so diaphragmatic excursion, measure 4 centimeters. Now, what I'm going to ask you to do, I'm going to check for symmetrical chest expansion. So breathe in for me. Great, really? Okay, great. So chest expansion is equal bilaterally. So I'm going to be auscultating. When you feel my diaphragm, just breathe in and out, okay? Okay, great. When you feel my diaphragm, I want you to say E for me. Okay, so E was heard, and that's a phonic test. E was heard, which indicates that there is no sign of consolidation. Now I want you to repeat 1, 2, 3 for me. So 1, 2, 3 was heard, however it was faint, which shows that there is no signs of consolidation. So now I'm going to be assessing your anterior chest. Thank you. Assessing your anterior chest. Okay, so skin again is symmetrical. It's even. There's no signs of lesion, no redness, no mass noted. No swelling. Do you have any tenderness when I palpate? No tenderness when I palpate. Okay, great. I'm going to be checking for her AP diameter. Okay, so AP diameter is 2 to 1 ratio, 1 to 2 ratio, sorry. Patient had no tenderness, now I'm going to be percussing, okay? So do this. This one. Okay, so resonance heard on percussion. Now I'm going to be auscultating. Okay, great. So no abnormal breast sounds heard on auscultation. Patient had clear breast sounds. No adventitious breast sounds heard. All lung fields were clear. What I'm going to do is for you to turn this side. I'm going to be assessing your blood pressure. So we'll be moving on to the cardiac aspect of our assessment. Okay, patient's blood pressure was 110/68. I'm going to be assessing her radial pulse. Okay, that's 15 seconds. Her radial pulse is 78 beats per minute. And her respiratory rate. Her respiratory rate is 16 breaths per minute, which is a normal finding, okay? So now I'm going to be assessing all of your, well, I'm going to be assessing these landmarks, okay? So there are 4 landmarks that I'm going to be assessing. So first, I'm going to be assessing for your aortic valve, which is going to be in the second intercostal right sternal border, right? And then your left sternal border, second intercostal space. This is going to be your tricuspid valve, your pulmonic valve, I'm sorry. Then in your fourth intercostal space, left sternal border is your tricuspid valve, and your fifth intercostal space, mid-clavicular line, this is located her mitral valve. Okay, so now I'm going to be auscultating. So I'm going to be using the bell of my diaphragm and the bell of my stethoscope and also the diaphragm of my stethoscope. So I will start with the diaphragm. So aortic, pulmonic, second intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, mitral, fifth intercostal space, left sternal border. Okay, now I'm going to be using my bell. Aortic, pulmonic, tricuspid, mitral. Okay, S1, S2 heard, no no extra heart sounds heard, no murmurs heard. I'm going to ask that you lean forward for me, please, and I'm going to be assessing your mitral. So just lean forward for me, please. I'm going to assess your mitral valve. Okay. All right. So S2, S1, S2 heart sounds heard. No extra heart sounds heard. So now what I'm going to do, I'm going to put the bed a little bit lower. 30-degree angle. Yeah. Okay. So you're going to turn to the left or to the right, whichever side is more comfortable for you. I'm going to be checking for jugular vein distension, so no jugular vein distension noted. I'm going to be assessing her carotid pulse. We do 1 carotid pulse at a time. Okay, so you turn to the other side, assess the other side, no jugular vein distension. I will assess her carotid pulse. Okay, carotid pulse first, pulsation is 2+, no distension noted. So now I'm going to be assessing her 4 landmarks again, but now I'm going to be palpating. I'm going to be checking for any thrills or hives. Okay, so I'm going to be assessing for the aortic valve, no thrills, no hives, pulmonary valve, no thrills, no hives, tricuspid, no thrills, no hives, no thrills, no hives, and then I'm going to be assessing her apical pulse, and this is just going to be a short, gentle tap that I'll feel, and this is usually a normal finding. Okay, Alright, oh, you can stay as you are. I'm going to be auscultating with my diaphragm again, and I'm going to be auscultating for any abnormal heart sounds. So first I'm going to be using my diaphragm, and then I move on, then I switch to my bell. So aortic, pulmonic, tricuspid, sorry, mitral. Okay, and I'll do with my bell, aortic, pulmonic, tricuspid, mitral. Alright, okay, great. So there's S1, S2 heart sounds heard, no extra heart sounds were heard, no abnormal heart sounds were heard, no murmurs, no gallops. Okay, so now I'm going to be assessing your vascular systems, and I'm just going to be assessing your extremities. And I'm not seeing any swelling, no redness, no signs of clubbing to the nails, no sign of clubbing to the nails, no edema, no signs of cyanosis noted. Okay, now I'm going to be palpating the pulses. Okay, so I'm going to be, I'll compare both sides. So radial pulse felt, brachial. Okay, so I'll let you respond to it a little bit. Femoral. Okay, I'll bring your legs up. Right. Dorsalis pedis. Posterior tibia. Okay, so all pulses were felt, they were normal, there were 2 plus pulsation that were felt throughout all pulses. Okay, so now I'm going to be auscultating and I'm going to be using the bell of my stethoscope to auscultate the landmarks of the abdomen. So I'm going to assess the abdominal aorta, no bury heard, the renal, iliac, femoral. Okay, so no bury heard on auscultation. Okay, so now I'm going to be assessing the abdomen. Excuse me. Okay, so no rashes, the abdomen is symmetrical, flat contour, no lesions noted, no swelling, skin color is evenly distributed, no signs of hyper or hypopigmentation. So I'm going to be percussing all 4 quadrants. I'll have you lay down. So we'll start with the auscultation. So we're going to auscultate all 4 quadrants, okay? So right lower, right upper, left upper, left to lower. Okay, so normal active bowel sounds heard. So now I'm going to be percussing from the right lower to the right upper. Okay, so tympanic heard in all 4 quadrants. There was no area of dullness. Now I'm going to be assessing for your liver boredom. So I'm going to be percussing, okay? Okay, area of dullness right here. So their liver span is measured 7 centimeters, and that is a normal finding. We're going to do go percuss to the right side as well for the left side for the spleen. The spleen, we're going to percuss from the 9th intercostal to the 11th, and the spleen is normal measurement for the spleen is 6 centimeters. Okay, that's a normal finding. Okay, so now I'm going to So now I'm going to be palpating the abdomen, and I'm going to be checking for any tenderness or any rigidity when I palpate, okay? So let me help you as well. Okay. Alright, so I'm gonna go light palpation and then I go deep palpation. You let me know if any tenderness when I palpate, okay? No tenderness, so there was no guarding, no rigidity. Patient did not complain of any pain during exam. Now I'm gonna do a deep. Okay, so no pain, no tenderness on palpation. Alright, so I'm gonna ask that you take in a deep breath. Okay, so the liver is palpable, which is a normal finding on the right upper quadrant. Then check for the spleen. Alright, so the spleen is not palpable, which show that there is no spleen enlargement, which is a normal finding. Now I'm gonna ask that you sit forward for me, please, and I'm gonna be checking for costovertebral tenderness, okay? So let me know if you have any pain when I strike.
No. No.
Okay, great. So this indicates that there is no costovertebral tenderness when the patient is struck in her flank. All right, so now I'm going to be checking her musculoskeletal system. So you can come down here. I want you to stand here. You're going to walk in a straight line. Okay, so no, patient has steady gait. Was smooth. Her motions were smooth. Her posture was erect. No stooping noted. I'm going to assessing your back. Okay, so no signs of kyphosis, scoliosis, or lordosis. No, her scapula is there even. No tenderness on palpation. No tenderness when I palpate. No swelling noted. Okay. All right. So next thing I'm going to ask you to do is that you're going to bend forward. Try to touch your toe. Okay. Great. Step forward a little. All right. So bend backwards for me now. Okay, great. All right. So patient was able to do flexion and extension. Now I'm going to ask you to lean to the sides. Good. Lean to the other side. Great. The patient was able to do full range of motion to her spine. All muscles appear symmetrical, no abnormal movement, no swelling, no deformity noted while doing range of motion to the spine. So now I'm gonna assess your TMG, okay? No tenderness when I palpate? Okay, great. So I'm gonna ask that you open your mouth. Okay, close. Good. Clench. Okay, good. Alright, shrug your mouth, your lower out and in. Okay, great. Alright. So patient was able to do full range of move to the side. Side. Great. Patient was able to do a full range of motion to her TMJ. Next thing I'm gonna ask that you do is for her spine, you're gonna just follow my instructions, okay? So move your chin down, then up, good, into the ear, here, turn to the side, turn to the other side. Okay, great. This indicates that patient was able to do full range of motion to her cervical spine. Next I'm gonna palpate the shoulder. No tenderness on palpation. Okay, no mass felt, no swelling. Okay, so now I'm gonna ask that you try to, what you're gonna do is to bring your arms out for me like this. Bring your arms out like this for me. Okay, great. And then you're going to extend. Okay, so we're gonna put one arm up over the head, put the other arm over the head. Okay, great. And then you're gonna put both arms onto the side. All right. So next thing, follow my instructions again. You're gonna reach behind, try to touch your shoulder. Reach behind, try to touch the other shoulder. Okay, so patient is able to do full range of motion to her shoulder, which is flexion, extension, abduction, and adduction, and also internal and external rotation. And there was no tenderness while doing these motions. Okay, next I'm going to assess the elbow. No tenderness when I'm palpating. Okay, no crepitus felt on palpation. Skin is warm to touch. No swelling. Okay, so now I'm gonna ask that you bend your up and out. Okay, same thing for the other one. Up and out. Great. Extend your arms over and down. Okay, great. So patient was able to do full range of motion to the elbow, flexion, extension, and also pronation. Next, I'm gonna ask that you, for your wrist, you're gonna put your wrist down and then up. Great. Flip to the side and then inward. All right, great. And then down. I'm gonna do the fingers. Okay. All right. Same thing. All right. So for the wrist, patient was able to do full range of motion, flexion, extension, and full range of motion to the radial as well, and radial deviation. Sorry. For her fingers, I'm going to ask that you use your thumb to touch all digits. Full range of motion to the fingers are intact as well. Okay, so next now I'm going to ask you to do, I'm going to be palpating the knee, the hips. Do you have any tenderness when I palpate?
No.
Okay, great. So I'm going to let you lay back. So feet up. Put you down a little bit more. Okay. All right. So you're going to lift your leg all the way up one at a time. Okay, great. Next one. Okay, great. All right. You're going to bring your feet out, up, out. Okay. Bend your knee for me, please. And I'm going to rotate, okay? In, out, in, or rotation, external, and internal. External. All right, great. So patient was able to do full hip range of motion, external flexion, internal and external rotation, and also abduction and adduction. All right. So now we're gonna do for the knees. Do you have any pain or tenderness here? No crepitus felt, no mass felt, no form of deformity. I'm gonna ask that you bend your knee for me, please. Okay, and extend. All right. Okay. Right. Same thing. Bend, extend. Okay. What is that? All right, great. Patient was able to do full range of motion to the knees, flexion, extension, and there was no pain or tenderness while doing range of motion. Now we're going to do range of motion to the ankles. Okay, so bend up, bend down. Okay, and no pain or tenderness, right? No crepitus felt. Okay, you're gonna push on my hand. Great. Push down. Okay, push up. Great. Push up. All right, great. So for their ankles and joints, there was no masses felt, there was no tenderness, there was no crepitus, and patient was able to do full range of motion to her ankle and to her feet. Okay, so now we're going to move on to our sensory. All right, so I'm going to ask that you tell me your full name and your date of birth. I know we did it earlier, but
Linda O, February 16, 1994.
okay, what month are we in?
May.
Do you know where we are?
LAU.
Okay, and what year are we in?
2024.
Okay, great. All right, I'm going to ask you to remember 3 words for me, okay? So I'm going to ask you to remember flower, car, and pen. Okay? All right, what did you have for breakfast this morning?
Oatmeal.
Okay, all right. Where were you born?
Taiwan.
All right, Taiwan. Can you spell the word world backwards for me?
DLROW.
Okay, great. Remember those 3 words?
Flower, car, pen.
Okay, great. So patient has good remote and recent memory, fluent in her speech and also clear, and she also has good recall. Okay, so I'm going to ask that you close your eyes for me, please, and I'm going to bring some objects close by. You let me know. So let's just start with eyes closed, arms stretched out.
Oh,
I'm stretch, yes, gear it to the ceiling, and you're just gonna keep it there for a couple seconds. Okay, so no upper extremity drift noted. All right, so that's great. All right, so I'm gonna be checking your TMJ. Okay, so what I'm gonna ask you to do is a clench. Don't allow me to open your mouth. Okay, great. So strength TMJ is 5 out of 5. I'm gonna do for your strength, muscle strength. You're gonna press against my hand. Don't allow me to turn your head. The other side. Good. So her muscle strength in her neck is also 5 out of 5. And you're gonna do the same thing for your shoulder. You're gonna shrug on my shoulder. Don't allow me to push down. Okay, great. So I just assessed her cranial nerve number 11, which is the spinal accessory, and her muscle strength. And her muscle strength is 5 out of 5. And her cranial nerve number 11 is intact. Excuse me. So for your elbow, I'm going to be assessing your elbow strength. So don't allow me to push up, down. Okay, great. Other side, push up, push down. Okay, great. Same thing for the hand. Push up, push down. With this hand, push up, push down. Okay, so her muscle strength in her elbow and also in her wrist is 5 out of 5. And now I'm going to be doing her muscle strength in her hip. Okay, so I'm gonna push up on my hand, down. Okay, great. Push up. Okay, other side. Push up, push down. Okay, great. So her muscle strength in her hip is 5 out of 5, and I'm gonna do the same thing with the feet. I'm gonna push up on my hand. Great. Push down. Good. Push down on my hand. Push. Okay. Same thing for the plantar. Push up. Great. Push up. Push down. Okay, so her muscle strength in her hip, knees, and feet, 5 out of 10. Patient had good resistance when asked to apply pressure. So now I'm going to be testing for cranial nerve, the central part of cranial nerve number 5, which is going to be the trigeminal. Now you're going to identify what is it that you feel, okay? So close your eyes for me, please. Okay. Let me know where you feel it and what is it that you feel. Let me know light, dull, sharp, or vibration.
Light to my right, light to right arm, right, light to my left arm. Right, light to my right leg, light to my left leg.
Okay.
You do that. Oh, sharp to my right arm, sharp to my left arm, sharp to my right thigh, sharp to my left thigh. Dull to my right arm, dull to my left arm, dull to my left thigh, dull to my right thigh.
All right.
Vibration to my right arm, vibration to my left arm, vibration to my right knee, vibration to my left knee.
Okay, so the sensory portion of the cranial nerve number 5 trigeminal is intact. Patient was able to identify dull, light touch, vibration, or sharp in all areas that were touched. Now I'm going to be testing your stereogenesis to check if that's intact. I'm going to keep your eyes closed for me, please. You tell me what you're feeling in your hand.
A pen.
Okay. What is it that you're feeling in the other hand?
It's a coin.
Okay. What is it that you're feeling over there?
A pen.
Okay, and in this arm?
A coin.
Okay, great. So stereogenesis is intact bilaterally. Okay, so now I'm gonna ask you to come back and you're gonna walk heel to toe. Heel to toe. Okay, great. So you're gonna come back. Okay, great. So patient was able to walk with good balance and in a straight line. You're gonna go toe to walk on your toe. Okay, great. Patient has steady gait. You're gonna walk back on your heel for me, please. Alright, great. Patient has steady gait and there were no tremors noted. Okay, so now I'm going to ask that you follow my fingers with your finger to touch your nose. Okay, patient was able to do smooth movements. I'm going to ask that you come back on your back after you lay down for me. Alright, so I'm going to ask that you touch your shin with your hand. You're going to rub all the the way down. Do both sides. All right, patient was able to do from heel to toe in a straight line, and there were no swaying. One more thing I'm going to ask you to do is that you're going to stand, and we're going to do the Rombert's test. So you stand right here for me, please, with your back turn. Okay, you're going to stand forward, close your eyes. Okay, patient was able to stand without any swaying and no staggering. Okay, so now I'm going to be checking your tendons. Okay, so I'm going to be checking. Okay. Alright, so turn around. Great. So this shows that patient's tendon reflexes are 2+, plantar reflexes noted, no fanning of the toes noted, and this concludes my examination. Thank you.